I woke up with pain in my neck. I've tried some stretching, but what else can I do? Welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and birth recovery specialist. I often have patients that come in, they're working on maybe their core pelvic floor, but they come in and they say, "Oh, I slept wrong, my neck hurts, I can't turn, to look over my shoulder when I'm driving," and they come in and they're very stiff. So this could maybe happen to you as well. I want to give you some tips besides stretching that may be really helpful for you to get out of pain. Number one is doing some axial lengthening, or basically just really stretching out through your spine and through the top of your head. This is a principle that I use a lot with low pressure fitness, and it's got a lot of benefits. I suggest starting in either standing or sitting. And basically, what I want you to do is just try to lengthen through the top of your head, almost like you have a string pulling you from the crown of your head up to the ceiling. And what you're trying to do is just create a little bit of space in the joints of your neck and all the way down to your lower back. You can also bring your arms out to the side a little bit. So if we think about your pain being in your neck, you may want to lengthen through your arms because that's going to indirectly help your neck and possibly be more comfortable than going right to the neck and trying to do some stretches. The second thing you can try is doing some gentle mobility exercises. The key here is to actually try this lying down on your back where the weight of your head is supported. So I recommend lie down on your bed where you're going to be nice and supported and you're going to have a soft surface underneath you. From here, combine the first tip, that lengthening out through the top of your head. So first you're creating space in the spine and it's just a very gentle opening. It's not an aggressive stretch. From there, what you can do is just work on some mobility. So turning your head, say, to the left side and going just until you're starting to feel a little discomfort, and then coming back to the middle. So nose pointing up towards the ceiling. And then again, go to the left side as far as you can without causing a lot of pain, just going to where your body is telling you there's a little discomfort, and then coming back to the middle. And so you could do a few on to one side and then the other. Now you may find with pain in the neck that you're able to go a little further to one side or maybe quite a ways further on one side versus the other. So you always want to be listening to your body and don't push it too much and don't push it into a lot of pain. From there, come back to that neutral position. And what you can do is try to look towards your belly button. So you're trying to bend forward, bringing your nose down towards your chest. And from there, again, you want to be lengthening out through the top of your head. So we're not trying to compress the bones of your neck or forcing anything. We're really trying to lengthen through the top of your head and then gently looking towards your belly button. Again, just going until your body's giving you a little discomfort and then coming right back to where you started at that neutral position or nose pointing up towards the sky. From there, after you've done a few repetitions of that, then you can even try going the opposite direction where you're extending. So looking up towards the wall behind you. So again, you want to respect your body. You may not be able to go very far depending on what's going on in your neck. Always listen to your body and respect where you're at, not pushing anything into an aggressive stretch. The third thing that I recommend is using a small inflatable ball to release into your upper back. So again, we might want to start not directly at the neck where you're having pain, but a little bit indirectly. So I would place the ball up underneath your upper back and see if you can find any areas that feel tight or maybe even a little discomfort, and just allow your body to soften over the ball, allow it to drape over, and allow your muscles to relax. When we do this, we're doing more of a myofascial release, and what I recommend is hold for a minimum of 3 minutes, but ideally if you can hold for 5 minutes, and again, allow your body to soften and let go. From there, you can move the ball up into the side of your neck, into those muscles of your neck, and just allow the ball to press up into that area. Now, if this seems to increase your pain and it's not seeming to settle down, then give yourself permission to stop the exercise. That goes with any of the things that I have shared. Um, you can use these tips at your own discretion. And by all means, if it seems to be making anything worse, please stop. So give those tips a try and see if they help you as well. If you do have persistent pain or this doesn't seem to be helping you, you want to have more guidance, go ahead and give us a call here at the Healing Spot Physical Therapy. We're happy to answer your questions and get you scheduled for a discovery session and get you taken care of. Thanks so much for watching this Ed Talk.